Heart disease is the leading cause of death in the United States, and February is American Heart Month. So this month's theme is a healthy start for a healthy heart. Let's do this. I'm Dani Lebovitz, a registered dietitian, nutritionist, and fitness enthusiast who loves to eat. Welcome to Dani's Delicious Dish, where we get serious about food, fitness, and living better. Food brings people together, it nourishes our bodies, and influences how we learn, grow, and heal. We're going to take you from the classroom, to the gym, to the market, to the kitchen. According to the American Heart Association, 92% of heart attack victims die before ever reaching the hospital. Statistics reveal that if more people knew CPR, then more lives would be saved. In fact, CPR double or triples the chance of survival. So today we're here with Mr. Stephen Brown, the American Heart Association Program Director for the 78th Medical Group, to teach us hands-only CPR. Mr. Brown?
Yes, I'm going to demonstrate the steps of hands-only CPR. Chest compressions are the most important part of CPR until the AED or advanced medical care arrives. I'm going to go over the steps of CPR. First and foremost, you must make sure that the scene is safe. If you approach a teenager or adult victim, the first thing you must do is ensure scene safety. So the first thing you'll do is say the scene is safe. Next, you have to check for responsiveness. Tap him and shout loudly. Hey, are you all right? Are you okay? If your victim does not respond, you're going to sit up and yell for help. Help! I need some help! If someone comes, you're going to point at that person and tell him or her to call 911. You call 911 and get an AED. While that person is going to call 911 and get the AED, you will assess your victim for signs of life, breathing, gasping, or any type of movement. Okay? For 5 seconds, but no more than 10. 1, 2, 3, 4, 5, 6. At this point, you do not want to touch your victim because you may cause artificial movement. So just scan the body, checking for signs of life. Once you've determined that there is no sign of life, you expose the chest by removing the clothes quickly. And you want to ensure that your victim is on a hard, firm surface. So if they're on a couch or a bed, you want to move them to the floor. Then you have to place your hands, use proper technique to place your hands to perform chest compressions. So with one hand, doesn't matter which one, with either hand, you're going to put the ball of one hand or the heel of one hand on the center of the chest. Okay? Then the other hand directly on top of that hand and interlock your fingers. Now you're going to lean forward so that your shoulders are parallel to your victim, because what you want to do is press the heart straight down, the chest straight down, squeeze the heart, allow for chest recoil so that the heart refills. So you want to push hard and fast at a rate of at least 100 compressions per minute. And a lot of people will use the song by the Bee Gees, Staying Alive, because that beat is 100 beats per minute.
So you're going to sing for us?
You probably don't want me to sing. Okay, ready, begin. 1, 2, 3, 4, 5, 6. Some people count to stay at 100 beats per minute, or you can recite the song in your head. Staying alive, staying alive, staying alive,
Perfect.
Staying alive. Now, this mannequin, unlike a real human being, has indicators. 2 green lights mean I'm pushing hard and fast enough. If I didn't have 2 green lights, either I'm not pushing hard enough or I'm not pushing fast enough. Right now, I'm not pushing hard enough. So I continue chest compressions because this is hands-only chest compression, hands-only CPR, which means you're just going to continue chest compressions, allowing the chest to recoil and pushing as hard as fast as you can until the person that you told comes back with the AED or the ambulance crew arrives, advanced medical care. So yes, you can get tired and exhausted from performing chest compressions. As soon as the AED arrives, I stop, grab the AED, place the AED on my side at the victim's head, the universal location. First thing I want to do is turn it on and listen to the prompts. Everyone,
remove clothes from
stand
patient's
clear.
chest.
Clothes is already removed.
When patient's chest is bare, open gray plastic case and peel off white adhesive pads.
Here's your gray plastic case. Open it up.
Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case.
Just follow the
Place
diagram on the pads.
exactly as shown.
What you want to do here is make sure you
Press
have
firmly
perfect
to
skin
bare skin.
contact. In other words, you don't want the clothing in between the pad and the individual.
When the first pad
So
is
what
in
if they had a
place,
hairy chest?
peel the second pad.
Good question. If
Place
they had a
pad
hairy chest
exactly as
and
shown.
you had an extra set of pads, there's a couple of
Press
things you can do.
firmly to bare skin.
You can press it firmly to the skin, and I have an extra set of pads, extra set.
Peel one white pad from the gray case. Place
Rip
pad
Rip it off.
Okay.
exactly as shown.
Now, let's say I do
Press
not
firmly to bare
have an
skin.
extra set of pads. Then what you can do,
When the first pad is in place, peel the second pad. Place pad exactly as shown.
the AEDs
Press
across
firmly
base,
to bare skin.
Robbins Air Force Base and in the medical facility, has razors attached in the first
Peel
response
one
kit.
white pad from the
So
gray case.
you will
Place pad
perform a
exactly as shown.
dry shave. for
And
your
then
victim.
place the
Press
pads.
And then
firmly
place the
to bare
pads.
skin.
And this is actually a real AED, okay?
When
This
the
is an
first
actual real
pad is
AED.
in place,
So
peel
it will
the
not
second pad.
prompt us
Place
to
pad
deliver a shock.
exactly as shown.
The AED will,
Press
I'm just going to turn it
firmly to
off
bare skin.
because it's not going to ask us to deliver a shock. The AED will analyze the victim. If a shock is needed, the AED will say, please, preparing a shock, everyone stand clear. That's when you will clear everyone. Everyone clear, everybody's clear, I'm clear, you're clear, everybody's clear. And then it will say, push the shock button now. Then once you have determined that everyone's clear, you push the shock button. Thank you for watching. This demonstration does not certify you in CPR. To get certified, visit your medical treatment facility or the American Heart Association website.
Get CPR certified and save a life today. I'm Dani the dietitian. Till next time, live deliciously.